Hello and thank you so much for joining us on this Good Friday, whether you're watching on TV or online. I'm Anthony Robart. We're waiting for the latest update from Prime Minister Justin Trudeau. That will take place in about 15 minutes or so from his home at Rideau Cottage in Ottawa. As he has done every day, he will speak to the nation and then take questions from reporters. And we have a number of Global News reporters standing by for this special coverage. Michael Couture is in Ottawa. Travis Danraj is in Toronto. In the meantime, let's look at some developing news and begin with the latest numbers from here in Canada and around the world. Globally, close to 100,000 people have lost their lives to COVID-19. But here's some good news. More than 365,000 people have recovered from the virus. And there are now more than 1.6 million confirmed cases of coronavirus around the world, a staggering number by any measure, with close to 500,000 of those in the United States. The number of confirmed cases in our country has passed a grim milestone as well. More than 21,000 Canadians have tested positive for COVID-19. More than half of those in Quebec, where there are now more than 10,000 cases. In Ontario, we have more than 5,000, or actually 6,200 is the latest number there. Alberta reporting more than 1,400 infections. Further west in British Columbia, that province has 1,300 confirmed cases. In Canada, more than 500 people have died. And that includes an employee at a hospital in Ontario. This is actually the first known frontline fatality in the province.
This is someone that knew he was taking on an enhanced risk being in healthcare, but never blinked at that responsibility.
The 58-year-old man worked in housekeeping and sanitation at Brampton Civic Hospital just outside of Toronto. Officials say the man began showing symptoms on March 20th, immediately went into self-isolation. He was hospitalized a week later. Health officials believe this was a case of community spread. Now, overall, more than 600 healthcare workers in the province have been infected. Parliament is set to be recalled on Saturday for an emergency session on the government's wage subsidy plan. A lot of back and forth on this. The Senate is also being recalled, incidentally. A skeleton crew of MPs is expected to debate and then vote on the government's $73 billion emergency aid package. Now, it needs unanimous consent to pass quickly. Meanwhile, the Conservatives are calling for Parliament to sit 4 days a week in person to keep check on the Prime Minister. And Ottawa is laying the groundwork to potentially invoke the Emergencies Act. Letters have been sent to provincial and territorial governments. The PM's office saying that was purely a procedural step, however. The Emergencies Act would give Ottawa power to override the provinces and restrict the flow of people and goods. Saskatchewan Premier Scott Moe and Ontario Premier Doug Ford have both voiced opposition to the measure, while New Brunswick Premier Blaine Higgs says it would, quote, unify our approach as a nation. All right, let's head to Ottawa right now and bring in Michael Couture. Mike, thank you so much for joining us on this Good Friday, of course. And let's start there. Let's start with the Emergencies Act. A lot of questions, a lot of controversy given the historical context. What could this mean if it were to be invoked? What would it mean for the country?
Well, as you mentioned, it could restrict the movements of certain people and making sure that, we go beyond just this sort of self-distancing or self-isolation and physical distancing to more of a stature where you wouldn't really be able to walk around as freely as you want to now. It's unclear if that would mean that there'd be members of the military or police forces in the street sort of enforcing that kind of a thing. But at the same time, I think it's worth noting that while that was discussed last night on that phone call with all the premiers, that the government, the federal government, has continued to be hesitant to go that route, even though Blaine Higgs has said that it may be worth it. And it would help coordinate some of the different responses, such as a lot of that personal protection equipment, and make sure that it's funneled to certain hot spots at certain times. Right now, though, it seems that the federal government believes that they're in a position, and the way that all of the provinces are responding so far is good enough, and that this is, they're happy to let the provinces stick handle this. And you have the same thing coming from François Legault out of Quebec. He has also mentioned in the past that, look, we don't think we need to get there just yet. Let the different provinces reply to it and sort of respond to it in that way. And consider this, in the prairies, we've seen some of those numbers. It's not spiking as much in Saskatchewan and Manitoba as it is maybe in Quebec and Ontario, and maybe that is why a lot of these premiers think that having them go it alone, having them respond in their own way, province to province, is probably the best way to do this. And as you mentioned off the top, this is purely for a discussion point of view and discussion reasons, and making sure that they have these discussions now in the case that they do need to bring it in, that then they can move rapidly in that way.
And Mike, we got numbers, of course, yesterday, the job numbers. More than 1 million Canadians lost their job in that 1 week span in March. Pretty staggering number by any measure. You also have latest CERB numbers, the Canada Emergency Response Benefit. That number pretty staggering as well. What have you heard?
Yeah, I just got it for yesterday. It had a total number of claims of 615,000 new claims just yesterday alone. Don't forget, anybody who applied yesterday had their birth month in the last 3 months of the year. So now it is actually open to anyone who wants to apply on Friday, Saturday, and Sunday if they still haven't applied. Total for the week, get this, Anthony, 3.08 million applications just this week alone. Friday hasn't even finished yet, so just in the 4 days of this week, that's how many they have. Total since March 15th, 5.62 million. And don't forget that if you applied for EI after March 15th, you are automatically put into that CERB stream, because they believe that's a quicker way of getting money to you and more efficient, and it's better that way. And the total number that they've processed is 5.08 million. So a lot of criticism has gone around for this government and for the civil service of how quickly this is going, or how slow it's going. But frankly, when you look at these numbers, 5.62 million that have been applied for since March 15th, and in that time, you've got 5.08 million that have been processed. Feels like they're doing pretty good, and I think there's a number of people that are going to be seeing that money in their accounts in the coming days, Anthony.
It is almost impossible to wrap your head around that number, because that number will change in the coming days as well. And if you at home are just joining us, we're just waiting for the Prime Minister's address to the nation. That will come really in about 12, 13 minutes, depending on what else is going on right now. So he will walk out the door, walk to the podium, and speak to everyone, and he will then take questions from reporters on this holiday, Good Friday. It's a long weekend, but it kind of feels like every other weekend right now, given the situation, what we're dealing with. I mean, Mike, also just almost impossible to wrap your head around. A lot of people are talking and trying to digest the numbers, the projections that came out yesterday. Obviously, it's a huge range. So there's so many what if, could have, there's so many possibilities that we're trying to establish. The staycation for the nation, I saw that trending online as well, which is interesting. Just, trying to look ahead. A lot of people are trying to focus on how long this is going to go. We really don't know, do we?
No, and that's the problem. I mean, the Prime Minister is trying to sort of set a little bit of light at the end of the tunnel for the country, and saying that eventually, the economy will come roaring back, and giving brief timelines yesterday, saying, first of all, that a sense of true normalcy that we saw before this won't return until we actually get a vaccine. And everybody knows, we've heard it before, 12 to 18 months away until it is full normalcy. But he also mentioned that, look, they expect that this first wave or this first spike of COVID-19 to possibly hit by the end of spring. Don't forget, we just started spring, or in the summer. And then after that, they're looking at the possible on the downslope. And don't forget, they want to make sure. The reason they sent out these numbers yesterday and they published them is to make sure that people understand that we have to remain vigilant. We have to remain self-isolating. We have to remain physical distancing, and that is why they put the worst case scenario on the board. But he also said, look, we are looking at what we can possibly do to get this economy going in the later stages and after we hit that spike, making sure that maybe we look at different ways of opening restaurants. This was something that the Prime Minister didn't speak, but I'm mentioning this because just before there was that full shutdown, you had in Quebec that they made sure that restaurants were open but only accepting half capacity so that people could be that sort of 2 meters away from each other. Will the government look to that as a way of sort of easing the economy back online and easing people out of these restrictions? The difficulty is that they also have to make sure that you don't have a rush of people just going out. That would be the worst case scenario, because they want to make sure people understand that we have to maintain this type of physical distancing for at least some time now.
Yeah, and that vigilance is especially important this weekend because there's so many people have the urge across the country to be with their families this Easter weekend. Passover, of course, is now as well. So, and I made the point earlier this week, speaking to a health official that I know, and the fear is among the colleagues there in the hospital is that in 2 weeks from now, that's the worry, that the numbers will spike again because that's when we could see people infected, or at least the symptoms showing. So, of course, we'll have to watch that. Mike, we'll have to leave it there for now. We will touch base after, but let's, if you're just joining us right now, we're waiting for the Prime Minister that's expected really any minute now. And I mentioned the numbers talking to Mike, and more than 1 million job losses in the country. Let's get a better breakdown of what these numbers mean. This is a million jobless, 1.1 million right now. And the country's unemployment rate climbing to 7.8%, up from 2.2%, largest one-month increase, in fact, since record-keeping began in 1976. This data collected between March 15th and the 21st, reflecting the first major wave of COVID-19 related layoffs. So, more to come, unfortunately. Provincially, the unemployment rate increased in all provinces except Newfoundland and Labrador and Prince Edward Island. The largest increases seen in Quebec, British Columbia, and Ontario. Ontario lost more than 400,000 jobs. Let's stay in Ontario and bring in Travis Danrej in Toronto. I mean, staggering numbers by any degree. Travis, thank you so much for joining us. I want to ask you about the testing, because so much when it comes to the case numbers in this country depends on testing. Ontario, the Ontario Premier, health officials criticized heavily because of the lack of testing. Any progression, any development on that front?
Well, you heard the Premier come out a couple of days ago, Anthony, and he was really frustrated. He made that very clear that he wants to see these testing numbers in Ontario go up. Ontario is testing the least number of people per capita than any province in the country, and he has set a goal of 13,000 tests a day. Now, yesterday when we got those numbers, they were about 4,000 or so, just over 4,000 tests. So we're not at that marker yet. But what health officials are saying is that initially they were in need of supplies, like the reagent necessary for testing. They wanted to get some of these assessment centers up and online, and they needed to ramp up testing capabilities. Well, now they have all of those supplies, but what they are saying is that they had a significant backlog when they did not have those supplies. And now they're trying to get through that backlog and up to that 13,000 number. We've just got the updated numbers of tests that have been done. This is since the outbreak began in Ontario. That number sits right now at 94,271. But certainly we are not seeing that 13,000 goal met. And there's a lot of concern for long-term care workers, long-term care residents. We have seen over 60 outbreaks here in Ontario. And the Premier says that he wants to see all of those workers and all of those residents. In fact, he wants to see all healthcare workers, frontline healthcare workers, tested in the province. Now, health officials said yesterday we're not at that point yet, but certainly they have widened the guidelines. They sent out new guidelines for testing yesterday so that more people can get tested. So really what the true test will be is these numbers next week, whether or not we see that number significantly increase or not, Anthony.
And connected to the cases and potentially the outbreaks at the long-term care homes, sadly, is the personal protective equipment and the lack of. We learned this week that many of them, half of the supply in Toronto, was defective in terms of face masks. I mean, that's just one element of the personal protective equipment. Where is Ontario as a whole, where the long-term care homes specifically, in terms of procuring and having enough of these PPEs to really sustain them through what has become an incredibly challenging situation?
Well, this has been really the huge issue for frontline healthcare workers and particularly long-term care workers as well. We know the situation that the province went through where there were masks that were allegedly stopped at the border, 500,000 or so, that eventually came through. This is when they were having issues with 3M and the Trump administration, that Defense Protection Act. Well, now that issue has been solved, and the Premier has said that, really we have to rely on Ontario to ensure that we have proper personal protection equipment. The Health Minister has said that there is an adequate supply, but we continually hear reports almost on a daily basis of PPE at hospitals and also in long-care facilities being rationed. There's also a report out today that, in Ontario and also some other provinces, there's reports of stolen PPE and facilities having to lock up their personal protection equipment and ration them. So it is crucial right now. The Premier says that it's all hands on deck, that he is continuing to talk with the business community to try to get some of these face shields, try to get some of these N95 masks and also surgical masks in place. But still, it is a hurdle, and it's one of the biggest problems in terms of that infection rate.
Yeah, right now, a little more than 5,600, that number changing by the day and going right now in the wrong direction. And I want to ask you, so on a political note, you are embedded in Queen's Park, you understand the players, and it's interesting as well for the rest of the country watching this to get a sense of Premier Doug Ford and his role in this, but how he's also being viewed. It's also interesting, he's developed an unlikely alliance with the Liberal government, some high-level individuals there. Kind of talk about that and how he's being received within Ontario as well.
Yeah, well, just to underline that point, the Premier has railed against the federal government when it comes to the carbon tax. That's one big issue that you have heard him get in a big battle with the feds on repeatedly. He was asked about that the other day at a press conference, and surprisingly, he did not use that opportunity to attack the feds. He said, listen, this is not a time for politics right now. Every level of government needs to work together.
Travis, I'm going to have to jump in right now. We'll pick up that point after. Right now, we're going to listen to Prime Minister Trudeau on this Good Friday. Let's take a listen there.
Whether you mark Good Friday or Passover, Easter, Tamil New Year, or Vaisakhi, usually this is a time we spend together. You might go to church or to temple or to volunteer. Last year, when I served a community lunch in Hamilton, I saw just how much people come together over these next few days. But right now, this weekend is going to be very different. You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood. I want to take a moment on that to have a word with kids out there. The Easter Bunny has a big job to do this year, and maybe there's something you can do to help. Ask your parents to let you put up a picture in the window to bring some extra chocolate for nurses and doctors. They need a lot of energy to keep us all safe, and this is how you can help them to do their job. Peu importe notre âge, on a tous notre rôle.
Regardless of our age, we all have a role to play to counter coronavirus. Earlier this week, I mentioned that Health Canada had launched an appeal for volunteers to help the frontline workers. Over 27,000 people have registered to help so that they can have some respite. Throughout the country, many people are doing their share, and I would like to thank everyone. You're there for each other, and I know that together we will go through this hard time.
But you don't have to go through them alone. If you've lost your job and are having troubles making ends meet, you can apply for the Canada Emergency Response Benefit. Millions of people have already had their claim processed, and they're getting their $2,000 deposit. Remember, you can apply today or this weekend if you haven't done so yet by going to canada.ca or calling 1-800-959-2041. If you own a small business and are struggling to pay the bills or pay your staff, we launched the Canada Emergency Business Account yesterday. You can now get a $40,000 interest-free loan through your bank or credit union. And if you repay it within 2 years, 25%, up to $10,000 of that loan is forgivable. It'll only take a few days for you to receive the full amount in your account. That's money you can use for whatever you need, whether it's monthly expenses or paying employees. On that note, we're getting closer to implementing the wage subsidy, too. We're working with other parties to get this in place as quickly as possible. Tomorrow, we're bringing back the House of Commons to pass the largest economic measures Canada has seen since World War II. It's really important, despite a time of crisis, in fact, because of a time of crisis, that our institutions remain strong and our democratic principles continue. Therefore, this address to Canadians tomorrow will be a little later and from the floor of the House of Commons. And on that note, I'll be taking Sunday and Monday with Sophie and the kids. But I'll be back Tuesday with more updates on how we're helping you. If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together. All across the country, there are stories of people stepping up to do their part. To ensure that Canadians are safe and our frontline workers have the support they need, we're helping companies join in the effort. Look no further than Fluid Energy from Alberta. They will produce over 1 million litres of hand sanitizer each month, with shipments starting as early as next week. We've invested in this large-scale production as part of our plan to have enough vital supplies produced right here at home. When Canadians work together, we get things done. Hier soir, je me suis entretenu encore une fois avec la vice-première ministre.
Last evening, I spoke with Chrystia Freeland and the premiers of different provinces and territories. We are all on the same page, and we're all working together to ensure your safety. During the long weekend, we will all have to stay home. We can't have gatherings for dinner, and we'll have to be creative to organize an Easter egg hunt inside the house. But it's not because we're physically separated that we can't be there for one another. We can organizing a dinner over Skype, call your friends, and you might want to make a donation to a charitable organization. Easter weekend will not be like it normally is, but I know that it can be filled with joy, laughter, and love. Thank you.
Floor for questions. Go to the phone line. One question, one follow-up. Operator.
Thank you. Merci. First question, Mike Blanchfield, the Canadian Press. Line is open.
Good morning, Prime Minister. Happy Easter, and whatever else is on your plate. G20 energy ministers are meeting today, as you know, and I'm just wondering what Canada's plan is for playing its role with other countries in the G20 after what OPEC did to cut production and to try to boost oil prices. What's Canada going to be doing?
Canada is part of the discussion, obviously, with the G20 energy ministers. Minister O'Regan is sharing our perspective and the challenges that we're going through in Canada, from Newfoundland to Alberta and Saskatchewan. We're going to continue to work because we recognize that this is a global challenge for many, many different countries, and having a concerted approach is extremely important. We noted what the OPEC countries did yesterday, and I know that's going to be a subject of discussion at the G20 energy meetings conversation today. Okay. Nous faisons partie de cette conversation.
We are participating in this discussion with the G20 energy ministers. Yesterday, we noted what the OPEC countries took as a decision. The discussions are ongoing. We know that Canada is strongly affected by oil production.
Prime Minister, so what do you see Canada doing? Do you see it cutting production along with these OPEC countries? If so, what effect would that have in Canada?
As we know, Alberta has already curtailed production and has for some time now. We're going to continue to look to make sure that other countries are doing their part and that people understand that the most important thing through this is to ensure that families and workers across the country and indeed around the world are getting the support they need to get through this crisis safely.
Next question, operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Hello, Mr. Trudeau. I'd like to come back on this conference call that you had with the premiers yesterday. You spoke about the possibility of invoking the Emergency Measures Act. This is to distribute medical equipment throughout the country. You say that provinces are doing a good job, and you're asking them to collaborate and send equipment to the hardest hit places. So if I understand, do you think that collaboration between the provinces is starting to fray? No. Collaboration is ongoing and is even improving between the provinces. We see that this is a historic moment. All provinces and territories are aligned together and are working together. As for the Emergency Measures Act, there are requirements that are very stringent with regards to consultations. And so we are undergoing this process in case we would have to invoke the Emergency Measures Act. We don't need to do that right now, and we hope that we won't need to. The way that our country works is that provinces have emergency measures that have been implemented. If those emergency measures were not sufficient, the federal government has an Emergency Measures Act that can be added. At the current time, this is not necessary, and we hope that it won't be. A follow-up question. This Emergency Measures Act, could this, well, still coming back to supply issues with regards to PPE, could this allow to centralize the purchase of PPE and to increase the purchasing power and to reduce the issue? The issue with regards to supply is not a buying power issue or a cost issue. Costs are on the rise. The reality is that different provinces and even different hospitals have connections with producers globally, and they're using these connections, these contacts, to try to obtain the equipment that they need, in addition to all the efforts that are being made by the country and different provinces. It's not a bad thing for everyone to be looking at what they can do while making sure that there's a coordinated effort and there is a coordination effort that is underway. There's a lot of collaboration, and for that, we don't need to implement the Emergency Measures Act. This collaboration is very strong right now.
Thank you. Merci. Next question, Steve Scheer, Reuters. Line is open.
Hello, Prime Minister. Good morning. There's a story out today saying that the Bank of Canada Governor Polas was not asked to extend his mandate, and I was wondering, I know there's a selection process in progress and that it's not over, but ultimately it is the government that decides. I'm just wondering if you think it makes sense for the current governor to stay on a bit longer to help underpin confidence during this crisis. Thank you.
This is an extremely important question because we know the important role that the Bank of Canada has in leading on monetary policy that is an essential part of our handling of this economic crisis related to COVID-19. The government has many fiscal measures, but a strong Bank of Canada is essential in getting us through this as well. And Governor Polas, as always, has done an extraordinary job and continues to do an extraordinary job. The process is ongoing and decisions haven't been made as to what the next steps are. Nous reconnaissons à quel point c'est important pour la
We
Banque
recognize that it's very important for the Bank of Canada to play a central role when it comes to Canada and our response to this economic challenge of COVID-19. Governor Paulos has done a wonderful job, and he demonstrates a high level of excellence during this huge challenge. With regards to succession, no decision has been made yet.
Yeah, if I could just follow up, can you give us an idea when that decision might be made?
The discussions and reflections are ongoing.
Thank you. One more question, please, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. I'd like to come back on the Emergency Measures Act. In what case would you invoke this? There are different scenarios that have been discussed with the provinces, whether it be supply challenges or seeking to restrict the movement of Canadians even more. There are different measures that could, in theory, be looked at. These measures are not necessary at the present time. If we look at the way the provinces are able to make their decisions and are able to implement the measures that they need to do, the tools that the federal government has, for example, the Quarantine Act, means that we hope that we won't have to invoke the Emergency Measures Act, and this would be our preference.
There are a number of tools that the Emergencies Act provides for, much stronger controls on distribution of necessary medical supplies and equipment, for example, or further restrictions on travel or on Canadians' freedoms. But as I said, the way our country works is that provinces have Emergencies Act that they can bring in with very strong measures that they have all done. If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act. But as I've said, it is our hope that we don't have to use it ever. We are seeing that the collaboration, the partnership among provinces and territories, and the way we're moving forward on this means that we might not ever have to use the Emergencies Act, and that would be our preference.
Un suivi?
Oui, donc ça fait presque un mois que votre gouvernement a développé.
Your government has begun measures over a month ago. What have you learned over the past few months?
Ce qu'on a dû faire dans le dernier mois,
what we've had to do is to go extremely fast, to create new methods, new programs, to deliver assistance to a huge amount of Canadians. Our capacity to do this has been tested over the past few weeks. We were able to do a lot to make sure that Canadians would receive assistance this week. We recognize that each time we want to go quickly to help as many people as possible, as quickly as possible. There are things to be improved afterwards, and we're working on that. I think that this demonstrates the extent to which our civil service is resilient, and they're able to deliver in extremely challenging circumstances. This will give us a greater amount of comfort. We will be able to implement appropriate measures, might be new measures, but we've been able to demonstrate that we're able to react quickly when the need is there.
things we've learned over the past month is that when it needs to, government can move very quickly to help Canadians. We've seen the money from the CERB flow last week into Canadians' bank accounts across the country. That was a monumental task for our public service, for hardworking Canadians across the country who make sure that they are serving Canadians with the best that they have. And I think that lesson that when it's necessary, we can move very, very quickly and nimbly as a government is one that should inform reflections of a government going forward.
Prime Minister, Rachel Haynes here from CTV National News. You've said a number of times that testing is an essential way to flatten the curve, and you spoke to Premier Doug Ford yesterday, who has also pushed for more testing in Ontario. But at the same time, we do know that there still remains a number of shortages when it comes to testing kits. How long will it be until every person who needs a test right now is able to get one?
We are continually ramping up our testing. We started earlier than other countries in terms of intensifying our testing programs. Certain jurisdictions are doing extraordinarily well on testing, like Alberta and British Columbia. Quebec is coming a long way very quickly, and Ontario is addressing some of the challenges that they've faced over the coming days. We know there is more to do, but we can certainly know that the lead that we've taken on testing is part of why we are seeing a flatter curve than other places. We've done significantly more tests in total than the United States has, and they're 10 times the size of us. So we know that Canada's testing regime has been good, but absolutely can get better, and we're going to continue to develop more testing kits, faster testing, because we know that even as we get through this first wave of COVID-19, once we are able to get into those coming months where we will be on guard but not as shut down or paused as we are right now, testing rapidly and efficiently of as many people as possible will be a key part of that path forward. Okay. Nous avons fait énormément de progrès en matière de dépistage.
We've made huge progress with regards to testing over the past few weeks. We knew from the beginning that testing for the virus was essential as a strategy to reduce the spread of COVID-19. Each and every day, we are improving our testing protocols. In BC and in Alberta, they are doing a lot of testing. Quebec has improved significantly over the past few weeks, and Ontario is addressing real issues that they've had with regards to the testing program. We know that there remains a lot to be done, and we're going to continue. This is going to be an essential part of going through the coming year without having the current restrictions, but also having the ability to limit further spread of the virus. We have tested a lot more than in the U.S. They are 10 times our population, and we've still done more tests. We know that we have to do more, and we will.
Past few weeks, you've made a number of announcements about Canadian companies and retooling facilities in order to ramp up domestic production. And you just said in one of your previous answers that the government can move quickly when it needs to. But there are still a number of Canadian companies who say that they can supply this medical equipment, but they're either getting caught in red tape or haven't heard back from provincial or the federal government. So how long will it be until these domestic supplies make it to the front lines and into hospitals?
We've had thousands and thousands of Canadian companies step up and offer to be part of supply chains for essential services, for essential equipment and medications. We are working with all of them as quickly as possible. There have had to be choices as to who we could move quickest with, who was furthest along, but we will continue to work with all companies who put up their hands to be helpful, to figure out ways they can best help. This is something in which all Canadians can pull together and are pulling together, and we will continue to do that.
Hi, Prime Minister. Crystal Logue with Global News. Is the federal government considering any measures, such as regulation or federal oversight, to ensure long-term care facilities are protected from this or future pandemics?
There have been a number of reflections and discussions on this. We've seen that British Columbia has taken strong steps to ensure the safety of long-term care workers and residents. Obviously, this is a point of vulnerability, as we've seen throughout the country in terms of the impact of COVID-19. We're continuing to work with health professionals and medical experts to make sure we're doing everything we can to protect our seniors.
We recognize that nursing homes for seniors and long-term healthcare facilities are places where infection can spread. Our seniors are more vulnerable, the workers are more vulnerable, and that is why we're looking at different proposals, including the proposal from BC, to make sure that our seniors are as protected as possible during this difficult time.
Is that a concern for the federal government, and what is being done to help protect them?
Of course, we are tremendously worried whenever a healthcare professional contracts the virus. That is why providing adequate and significant amounts of personal protective equipment, making sure that protocols are being followed, helping provinces adjust their medical systems in ways that protect our healthcare workers is absolutely essential. We need our healthcare workers not just to stay healthy for their own benefits or the benefits of their families, but we need them to be able to stay healthy for the benefit of our entire community. But we also need them to know that we have their back as they don their protective gear, as they go into battle against this virus for the rest of us. We need to make sure they're getting all the support they need, because they are the ones that are going to save Canadians.
We recognize that it's very important to provide all the help, all the PPE, all the help possible to our frontline workers. That's why we're working so hard to make sure that we have a coordinated approach, that they'll have the equipment that they need, and that we are able to protect the workers in the healthcare system. We recognize that they need to be protected not only for themselves, their families, but people need to know that we're there for them. They are going to be fighting against COVID-19. They are on the front line. They are the most at risk to ensure our safety, and we have to be there for them. We need to recognize all their hard work and make sure that they continue to do this extremely important work that they're doing for us.
Note prepared for your Minister of Health on March 10th actually said that the risk of the spread of the virus within Canada remains low at this time. How do you explain the misinterpretation of the threat of the pandemic at such a late stage?
I think we saw that within days we'd begun to take very serious measures to restrict travel, to encourage social distancing. We moved very quickly and earlier than some countries on countering the potential spread of the virus. At those days, the numbers of Canadians infected were still low, but we saw the potential that we are in right now, and we started to act early. And that's why the measures that we're taking right now, the significant measures that we're in right now, are keeping us, we are hopeful, on the best possible curve to get through this in the coming months. Nous avons reconnu que ça commençait à devenir de plus en plus grave et le potentiel.
We saw that the potential was there for a more severe impact throughout the country. That is why we acted quickly to limit traveling, to encourage people to engage in social distancing, and we took important measures that made sure that the impact in Canada was lessened and was slower than in other countries. We're going to continue to take the necessary measures so that the impact will be lessened. And
advice that there was a low risk of the spread of this flawed? And what impact did that have on your government's work to contain the virus?
Our work continued every step of the way, informed by the recommendations made by our health officials. We wanted to both make sure that there were no panics on Canadians, while at the same time getting people to take more and more significant measures, because we knew that the behavior of Canadians was the strongest way of doing what we've been able to do so far, which is slow the spread of the virus, delay it beyond where it's been in other countries, and give us the best possible chance of getting through it. As we look back, of course, there's going to be things we said, oh, we might have said this differently or that differently. There's going to be an awful lot of learning through this. But it remains that as we get through this now, as we live through the measures that we've put in place and lean on each other and hold together, we have the best chance of getting through this in the coming weeks and months by remaining true to the advice that experts are giving us, to stay home, to keep 2 meters apart, to wash our hands regularly, to not go outside unless we absolutely have to hunker down, lean on each other virtually and metaphorically, and be able to support each other through this time. Nous reconnaissons qu'il y a toujours des façons de dire on aurait pu faire ceci, on aurait dû faire ça.
In hindsight, it's easy to say that we should have done things differently. The reality is that we acted quickly and we took measures to slow the spread of the virus in Canada. If we compare with other countries, we are on a track that should allow us to get out of this pandemic more quickly than other countries. And we need to continue. We have to stay home. We have to continue with social distancing, to not go out unless it's essential, to wash our hands frequently. These measures will allow us to go through this pandemic in the best way possible, and also to rebuild our economy as quickly as possible. Yes, on the economic crisis, yesterday François Legault was saying that soon some sectors of the economy would be able to open up again. And you were saying it would take a year and a half before finding normal. So on a federal level, are there some sectors of activity that will be able to open up again soon, and which ones? We cannot talk about a return to the normal, before we have a vaccine against COVID-19. But there are many things that we can do. We can let up on some measures after having gone through this first wave. In our models, we can see that this lessening might be able to begin, or this lessening might begin this summer. But during this pandemic, we have to live with some measures to keep us safe, to minimize the risk of a resurgence and a second wave of COVID-19. So we're not going to go back to normal as it was before COVID-19, before we have a vaccine against the virus. But there are different sectors of the economy, different economic activity that will be able to start up again once this first wave is over. And we are in discussion with the provinces and with different industries, with healthcare experts, and our science experts as well. We're trying to determine where we can let up and how we can recover gradually. I agree with Mr. Legault. We should be able to do this in the weeks and in the months to come, but we also have to think about this very carefully and coordinate on how. It can be quite discouraging. Yesterday, when you said it might take a year and a half for a vaccine and for life to go back to normal, when you talk about economic sectors that might start up again, what measures could be in place for a year and a half? What are we talking about? People over the weekend are trying to understand. They're trying to understand what to expect in the months to come. We are in phase 1 of the virus. Right now, there is a spread of the virus throughout the society. It's concentrated in some regions, but we're all vulnerable to COVID-19 right now. We are taking measures, for example, staying at home, to not go to work if we can work from home, to not go out unless it's for essential things. People know full well what the situation is right now. People have seen our economy be paused, and our lives have been put on pause, and this needs to continue until we go through this first wave of COVID-19 cases, and this should be the worst wave. Afterwards, we will be able to lessen up on some measures. Maybe more people can go to work. Schools might begin to reopen. Economic activity might start up again. But we would do this in a gradual way in order to maximize our safety measures and minimize risk of having further spread of COVID-19. At that time, we will have developed better protocols for testing. We will have technical and technological capacity to do contact tracing rather, and we will be in a much better position when it comes to limiting other peaks with regards to infection rates of COVID-19. We're not going to go back to normal as we knew normal to be, but we'll be able to do many things that we cannot do right now and that we'd like to do. There will be continued vigilance up until the availability of a vaccine. When will this be? We don't know. It could be in 6 months, in a year and a half. We don't know. We don't know how long this is going to take. Our researchers are working on the issue. What we do know, though, is that our ability to make sure that this first wave will end this summer depends entirely on us, on citizens, on people who continue to stay home, continue with social distancing, continue to do what we're doing right now for many weeks to come. And we might talk about easing up on the measures during the summer.
What we are in right now is the first phase of the spread of the virus. This is the phase that runs to a certain extent unchecked or difficultly checked through our society, through our communities. We're seeing new cases pop up here and there. We're seeing people struggle to handle it and to keep these measures from overwhelming our healthcare system. If we do things right, this will be the first and worst phase that we go through as a country in terms of COVID-19. If we keep these measures, these strong measures in place of staying home, of not going outside unless we absolutely have to, on keeping 2 meters apart, in being strong about social distancing. These are the things that will ensure that we will get through this first wave of the virus as quickly as possible with minimal loss of life as well. This is what we're looking for, of not overwhelming our healthcare system. And that happens if we stay strong about remaining at home for the coming weeks. According to the models we've put forward, it is possible that we will be able to be out of that wave this summer. And at that point, we will be able to talk about loosening up some of the rules that are in place, looking at particular sectors where people can go back to work, bringing in new rules around how people can interact with each other in society and get things rolling again. We'll have to be very careful about how we do that, and we will have to remain vigilant and active every single day for possible resurgences of the virus. At that point, however, we will have developed much better testing protocols, because every single day we're improving them. We will develop new technologies for contact tracing, and we will all become much, much better at reacting when a possible resurgence happens. So as we look at possible resurgences over the coming months, we will be better adjusted and adapted as a society to minimize them, and therefore minimize the disruption to everyday life, to our economic activity. That is the ideal scenario. But it only happens if we continue to stay strong for the coming weeks and stay, inside, keep those 2 meters apart, and be very, very careful about not allowing COVID-19 to spread further. That phase of vigilance, of easing off to a certain extent, but still being careful, will continue until such a time as we have a vaccine for the virus. Researchers across Canada and around the world are working hard on this. It could take as little as 6 months. More likely, it'll take a year or a year and a half, maybe even longer. But I know the best minds are working on that. So we will, once we're through this first phase, be able to get back to something that is more normal, but we will not get back to the normal that we had before, at least until we have developed a vaccine for the virus. That is the reality, but the fundamental bottom line that people can reflect on this weekend is, if we stay strong in our social distancing measures now and for the coming weeks, we can see how things can start getting back to normal in the coming months, and we will be able to get through this, because that's what Canadians do. We lean on each other, we support each other, and we figure out how to get through the big challenges that life throws at us. Merci beaucoup tout le monde. Have a wonderful Easter.
And that concludes the Prime Minister's address on this Good Friday. Some news there. Some of it was a reiteration of what we have heard already. The big takeaway, let's bring in Mike LeCouture, who's joining us in Ottawa. The big takeaway for me, Mike, was that the Easter Bunny is not in quarantine, an essential worker. Obviously, my kids will certainly appreciate that. So obviously, that's some good news. Nonetheless, the big priority for the government, of course, is getting this wage subsidy bill passed. They are going to be sitting tomorrow, a bit of a different kind of scene when it comes to Parliament. Kind of lay that out in the politics, making sure that this actually happens, because it needs unanimous consent, doesn't it?
Yeah, it does. And frankly, it looks like they are on the path towards that. There have been discussions with opposition parties in the last week to try and make sure that when they get back into the House of Commons, that it's not a repeat of the last time when they tried to pass that CERB bill, which, turned into a bit of a show, unfortunately, where unfortunately in the legislation, it gave the finance minister sweeping powers to raise and lower taxes until the end of 2021. Probably safe to say the government is making sure that they're crossing all the T's and dotting all the I's to make sure that nothing like that is in there, so that when the opposition parties take a look at it, that they don't go, well, sorry, we can't go ahead with this. To that end, you have the Senate that says they're ready to sit at 4 p.m. tomorrow and get this thing through both houses of Parliament, have it receive royal assent, and then finally get going. As the Prime Minister said, he'll be back on Tuesday. He'll be at that sitting tomorrow, but won't be addressing Canadians on Sunday or Monday, and then on Tuesday likely, to stand there and say, all right, it's passed, here we go, this is finally gonna go out and help a lot of these businesses retain people on the payroll. And also something that I thought was really interesting, and even though we've heard it before, he was a lot more forceful today on trying to help people understand a timeline to when we might be easing some of these restrictions and some of the health measures that have been put in place for physical distancing and the such. And he said, look, that's not going away until we actually have a vaccine. We still will have some iteration of that, but he continued to say, if we do this for the next few weeks and we see the peak and we get over that hump, then we can have at least an idea of where we're going in the next few months and possibly easing off of some of these restrictions. And I think he hammered it home. He says, that's the message I want people to take away and to think about this weekend, that you have to do that work, and then we can get to the work of restarting this economy economy and possibly saying, okay, we can sort of take our foot off the gas a little bit and then have people, maybe socialize a bit more while at the same time being safe. And I think it was important for the Prime Minister, in his mind, to have that positivity, leave people with that sort of glimmer of hope, that light at the end of the tunnel, so that you're not going into the Easter weekend feeling like it's going to be continued doom and gloom right up until the end of this year.
Yeah, the proverbial Easter bunny carrot that people at least need to sort of get them through this, right?
Well
because
done,
this
Anthony.
Is,
well done. Wow. Look at you go.
Yeah. I had all morning to work on that one, apparently. So, yeah, I mean, look, the bottom line is that there's so much that everyone's trying to wrap their head around. And it's difficult for a lot of people because this is a difficult weekend. It's a difficult weekend because this is the time when people should be with their family and they can't be. A lot of people celebrating Easter, Passover, Ramadan with, virtually. So, yeah, it's one of those interesting situations that we're all trying to get used to, and we're all going to have to get used to for a while. Mike, we'll have to leave it there. Thank you so much. I hope you have a good Easter weekend. And as always, thank you so much.
Thank you, man.
Thank you. So here is a quick recap of what the Prime Minister announced today. Passing the wage subsidy bill remains the top priority when Parliament sits tomorrow. Trudeau will speak from the House of Commons. He is taking Sunday and Monday off to be with his family. The Prime Minister was also asked about the Emergencies Act and invoking this. He said at this time, we do not need it. He hopes we will not need it in the future. He says collaboration with the provinces and territories is improving and, of course, ongoing. Here's a number as well that is startling. More than 5.5 million Canadians have applied for the CERB. More than 5 million have been processed already, so that is moving very quickly. All right, some developing news, of course. They will have it all on globalnews.ca and Global National. For everyone here at Global News, I'm Anthony Robart. Thank you so much for watching on this Good Friday. Have a safe Easter weekend.
Bonjour tout le monde. Good afternoon, everyone. Comme on sait, les prochaines journées vont être à la fois importantes et différentes de ce qu'on vit normalement. Plusieurs d'entre nous, plusieurs Canadiens, vont au cours des prochains jours souligner la fête de Pâques, la Pâques, Vaisakhi et le Ramadan, entre autres célébrations religieuses. Et cette année, bien, nous devrons célébrer à distance, tout en restant proches les uns les autres, en pensée certainement, mais aussi en utilisant les moyens technologiques dont on dispose, le téléphone, la vidéo, et en posant des gestes d'entraide qui vont continuer de faire en sorte qu'on prenne soin les uns les autres. Et en particulier des aînés qui, comme on le sait partout au Canada, vivent difficilement la période d'isolement que nous avons maintenant à travers le pays. Donc, c'est une période où on va continuer de prendre soin les uns les autres en continuant, entre autres, de respecter les procédures d'isolement, les directives en matière de distanciation physique. On se lave les mains régulièrement et on continue de prendre soin donc de tous et de toutes. So, the next days will be both very special and very different from earlier days. Many Canadians will celebrate Passover, Easter, Vaisakhi, or the Ramadan, among other religious celebrations. We will do these celebrations by being distant from each other physically, but by being close to each other in heart, by looking after each other, and using modern technology, phone, of course, which is not so modern, but also video connections, and broadly looking after each other in those important moments. While we do this, we will want to continue maintaining the important directives on self-isolation, physical distancing, and washing our hands regularly, so that we can emerge from the current crisis as quickly and as safely as possible. Ce matin, nous allons avoir des interventions de la part du Dr Tam, suivi d'une intervention de la part du ministre Qualtrough et du ministre Miller, et les docteurs New et Wong vont être là pour pouvoir répondre aux questions. Alors, Madame la Dr Tam, à vous la parole.
Bonjour, everyone. I'll begin with our usual update on the number of COVID-19 cases in Canada. There are now 21,243 cases, including 531 deaths, with many of these deaths linked to long-term care homes. For the lab testing, we've completed tests for over 383,000 people, with now over 5% confirmed positive, as Canada continues to improve testing to track where the disease is spreading. Yesterday, we shared the modeling numbers that are helping us visualize how the epidemic might unfold over the coming months and to plan accordingly. The numbers were hard to bear, but knowing what the options are, I know that we are all convinced that crushing this epidemic curve is the right way out of any bad trajectory. In the midst of this hardship, Canadians are showing there is a lot to be thankful for. Being a bit behind other countries' trajectories in the COVID-19 pandemic has given Canada a chance to implement measures earlier and interrupt chains of transmission. Hier, nous avons présenté les données de modélisation qui nous permettent de visualiser comment l'épidémie pourrait se développer
that are helping us visualize how the epidemic might unfold over the coming months and to plan accordingly. These numbers were hard to hear, but knowing what the options are,
nous devons reconnaître l'importance critique
we are all
de mettre
convinced
toutes les chances de notre côté en empêchant la courbe de s'accentuer.
Doing everything we can to put luck on our side to flatten the curve is the right way.
La population canadienne peut se rassurer du fait que la pandémie de COVID-19 a touché le Canada plus tard que d'autres régions. Ainsi, le Canada a pu appliquer rapidement des mesures qui lui ont permis de bloquer les chaînes de transmission.
More quickly, some measures
Though
to
the
block the chain
time
of transmission.
may seem like it's been standing still, we've actually achieved a great deal together over the past several weeks. We've held our own through the progression of the epidemic, helped our fellow Canadians to come home from abroad, and kept our health system from being overwhelmed. These have been no small achievements. Changing our routines has been difficult, and the uncertainty has made us all feel the strain. But seeing the numbers and where things could go means we've got to double down on our resolve to stay the course. Many Canadians will be spending this long weekend with family and friends through cyberspace. This year, it's got to be all about the staycation for the nation. It is really uplifting and energizing to see so many people taking the charge to do all sorts of fun and creative things during their staycation. The choice of where to be, home in your bubble, with your existing household members only, has never been clearer. There is no choice but to plank the curve, then crush it. Thank you.
Merci, Dr. Tam. Je vais maintenant passer la parole à Carla, ministre de l'Emploi et du Développement social.
Jobs and Social Development.
Hello, bonjour. J'aimerais commencer en partageant une mise à jour sur le numéro de la prestation d'urgence du Canada. Yesterday, we received just over 615,000 new CERB applications. This brings us to a total of 3.8 million since Monday and 5.62 million since March 15th. To date, we have processed 5.08 million total CERB claims. That means that since March 15th, millions of Canadians would have seen and will see their first CERB payment of $2,000. I know that there have been reports and some confusion around additional payments that people may have received, and they're wondering what they should do next. Je tiens à être clair. Notre priorité est de faire en sorte que les Canadiens qui ont droit à la prestation puissent y accéder de la manière la plus simple et la plus rapide possible.
And most simple way possible.
We designed a simple system that could automatically process claims in a straightforward way and deliver money to Canadians quickly. To do this, we put most of the integrity measures at the back end. We're delivering a single benefit to Canadians who are EI eligible and EI and non-EI eligible. If you are eligible for EI and apply, you'll be receiving the CERB. If you are not eligible for EI and apply, you will be receiving the CERB. The only difference is in how we process these claims. This benefit is jointly delivered by Service Canada and the CRA. If you are eligible for EI, we will process you through Service Canada. If you're not eligible for EI, we'll process you through the Canada Revenue Agency. Online, regardless, all Canadians apply at www.canada.ca/coronavirus-CERB. From there, our system asks a few simple questions to make sure you go through the right side of the system. And we're asking Canadians to do their part by following the process and honestly answering the questions on your screen. Now, we know that some Canadians may have been worried that they applied for EI but not the CERB, so they ended up applying twice. This means that some Canadians may have received 2 payments. Don't worry, it's fine, we're on it, we're sorting it out. CRA and Service Canada are working together to ensure that these situations are reconciled and payments do not exceed the maximum amount allowed per individual of $8,000 over a 16-week period. We'll be in touch with Canadians that have received 2 payments of $2,000 with details on next steps. You don't need to contact the call center. I repeat, you don't need to reach out to us at this time. But we are reminding Canadians that you are eligible for a maximum amount of $8,000 over 16 weeks, meaning if you got an additional extra payment this month, you must budget accordingly. Some Canadians who are eligible for EI could have also received additional funds, however, not a double payment of $2,000. In these cases, these are other entitlements which you previously qualified for, but were paid out at the same time as you got your CERB when you were automatically enrolled through Service Canada. In these cases, you don't need to worry. There is nothing for you to do. Je tiens à répéter que si vous avez déjà fait une demande d'assurance emploi depuis le 15 mars, vous serez automatiquement inscrit à la PCU et vous ne devez pas faire une nouvelle demande.
Automatically eligible for the CERB.
Je vous encourage à consulter le site web du gouvernement pour en apprendre plus.
To go check the
Continuerons à travailler 24 heures sur 24
to work
pour
around
nous
the clock
assurer que les Canadiens obtiennent le soutien dont ils ont besoin pendant cette période critique.
during this
Merci.
critical
Thank
period.
you.
Thank you.
Merci beaucoup, Carla. Et on aimerait maintenant passer la parole à Marc, ministre des Services autochtones.
Minister.
Merci, Jean-Yves. I would like to begin first by acknowledging that we are gathered on the traditional territory of the Algonquin people. Good afternoon, everyone. Long-standing social and economic inequalities mean Indigenous communities could be disproportionately affected by COVID-19. During this pandemic, my sole priority is the health and safety of the Indigenous peoples in Canada. As such, we are focused on the public health response that will save lives. The transfer of $305 million in funds to support Indigenous communities and organizations across Canada has begun. The funding will address immediate needs and to help Indigenous communities prepare for and react to the spread of the virus. We know that each community, each nation, has its own unique needs, and the Indigenous Community Support Fund is designed to give the maximum flexibility to address them. While the majority of those funds are flowing directly to communities, $15 million will go towards Indigenous organizations providing services to Indigenous peoples in urban centres and those living off reserve. As announced on Monday, these organizations are invited to submit their applications online now. I do readily acknowledge that these funds may not be sufficient. Nous continuons de travailler avec les communautés, les partenaires autochtones et les provinces et territoires pour nous assurer que les ressources nécessaires telles que l'équipement de protection individuelle, l'eau, le désinfectant pour les mains et les tests sont en place pour prévenir et combattre la propagation de la COVID-19. En collaboration avec les communautés autochtones, nous continuerons d'adapter les plans et de fournir une capacité sur mesure en matière de personnel médical au fur et à mesure que l'évolution au fur et à mesure de l'évolution de la situation. Nous avons également fourni des recommandations et des protocoles pour soutenir les communautés qui ont été traduits en plusieurs langues autochtones. Ce contenu comprend des protocoles d'autosurveillance pour les prestataires de soins de santé en communauté et des soins à domicile, ainsi que des directives concernant l'éloignement physique, en particulier en ce qui concerne les personnes vulnérables. Directives qui doivent être suivies. À ce jour, nous avons expédié 470 demandes de matériel de pays
sent on 410, expedited 410
les postes de
requests for
soins infirmiers,
material.
les centres de
And in
santé de chaque
terms
région
of the
disposent du
healthcare
matériel nécessaire à
centres
l'administration
and other
des
testing
tests
facilities in the
et nous
various
travaillons sans
groups,
relâche pour
people
obtenir
have
des
what
tests
they
supplémentaires auprès
need,
des
and we are
provinces et des
working
territoires
as hard as we can to
afin de les
obtain
distribuer
further
aux
testing
communautés
kits to
autochtones
be able
éloignées et
to
rurales,
provide them
surtout
to
en
rural
fonction des
and
besoins.
remote Indigenous
En date du
communities
9
based
avril,
on
il y a
needs.
maintenant 40
As of
cas
April
confirmés
9,
de
there
COVID-19
are
dans les
40
communautés des
confirmed
Premières
cases
Nations,
in the
dans les
First Nations
réserves,
communities
et
on
5 cas
reserves
dans les
and 5
communautés
cases
inuit
in
du Nunavik. To date,
Inuit
there are now
communities in
40
Nunavik.
confirmed cases of COVID-19 on reserve and 5 in Nunavik. Through this time, we are seeing great leadership in action as communities are taking strong and necessary and innovative measures to prevent the spread of the virus. For example, the At Home on the Land initiative to help Indigenous families in the Northwest Territories move onto the land where they can maintain safer physical distances than if they were to remain in their home communities. Some communities are adapting community spaces to support self-isolation measures. Other communities have ordered ready-to-move structure trailers in order to have additional space available. For communities that require alternative health infrastructure and resources, we are exploring all options with our partners to best meet communities' need. We are actively getting resources out the door and stand ready to deploy additional resources. I recognize the concerns about capacity and resources, in particular in remote and fly-in communities. And I'd note we are actively working to expand nursing contracts and assessing the need for other health professionals such as paramedics and first-line responders to help emergency responses. We've also recommended First Nations with upcoming elections not to proceed with elections at this time as a result of the current associated public health risks. We've introduced a temporary regulatory option, the First Nations election cancellation and postponement regulations that will allow First Nations leaders to continue exercising their roles and duties within their communities for up to 6 months, with a potential extension as leaders focus on preventing the spread of COVID-19 for the next year. The decision of whether to hold scheduled elections in the current context of the spread of COVID-19 remains with First Nations. In addition, I recognize that this unprecedented situation can place unprecedented financial burden on Indigenous families, especially the most vulnerable. The Indigenous Services Canada Income Assistance Program provides funding to allow First Nations to match rates and eligibility of their province of residence. As a result of this program, BC First Nations will receive $300 per month per adult, as was announced by the government of BC for current income assistant clients living on reserve. We've seen a lot of positive measures taken by Indigenous communities to protect their populations. I want to recognize again their important work and the strength that they have shown. But let me be clear, this is just the beginning. We know more support will be needed, and we will be there to make sure no Indigenous community is left behind. By working together, we can save lives. To those in isolation, I want to assure you that you are not alone. Canada will be with you every step of the way. Miigwech, Nakumik, merci, merci, thank you, Tonika.
Thank you, Mark, and we will now be pleased to answer any questions.
Okay, so as usual, we'll start with 3 questions on the phone before turning to the room. 1 question, 1 follow-up. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question est de Marie Vastel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour. Ma première question pour M. Duclos, si possible. Je voulais revenir sur les chiffres de chômage qu'on a vus hier, des chiffres énormes de taux de chômage. On a aussi vu vos propres pronostics, vos propres modèles qui parlent d'une épidémie qui pourrait s'étirer jusqu'à l'an prochain. Dans la mesure où on est déjà clairement en récession, est-ce qu'il y a un risque de sombrer, vous l'évoquiez vous-même il y a quelques jours, de sombrer en dépression? Si tel est le cas, on a déjà dépensé 100 milliards de dollars en aide directe aux Canadiens ou aux entreprises pour les 4 prochains mois. Avez-vous vraiment assez d'argent pour continuer de dépenser dépenser encore, si on extrapole, 300 milliards pour se rendre jusqu'à l'année prochaine?
Si vous me permettez, je vais répondre premièrement. Je vais passer la parole à Mme Carla Qualtrough pour des détails sur les chômages si elle souhaite les fournir. Mais soyons très clairs, nous sommes dans une situation d'urgence que le Canada n'a jamais connue.
Canada is going through an emergency situation that we've never seen before over the past many generations in terms of health and the economy. And that's why Prime Minister Trudeau was very clear. We are going to do everything to make sure the families and workers have what they need to make it through.
Ou si nous souhaitions ne pas le faire, on
If
aurait
we
au
didn't want
Canada
to do that,
une immense
we
crise sociale.
would end up
Nous avons
with a
aussi
huge
pris des
social
mesures
crisis
rapides
in
pour
Canada.
sécuriser
We
le tissu
also
économique
took
de
rapid
notre
measures
pays, c'est-à-dire
to
sécuriser la
secure
capacité
our country
des
in
entreprises
terms
de
of,
garder leurs
what's
travailleurs
happening
et de les
socially.
payer à l'aide,
That is
entre autres, de la subvention
ensuring that
salariale.
employers
Nous avons au
have
Canada
the
une
means to
situation
pay their
fiscale
workers and to retain them
avantageuse
through the
par
wage
rapport
subsidy.
certainement à tous
We
les pays du
are
G7. Nous avons une
lucky
capacité
in
fiscale
our
et
fiscal
d'intervention
capacity
très
in Canada
significative. Et le
compared
Premier
to the
ministre
other
Trudeau
G7
l'a
countries.
dit très
And
clairement,
Prime
nous
Minister
allons
Trudeau said it
continuer
very clearly.
à
We will
utiliser cette
continue
capacité
to
fiscale
use
et cette
this tax
capacité
capacity and this
d'intervention
fiscal
et
capacity
d'appui
to
aussi longtemps qu'il
intervene
le faut.
and support
Carla?
as long as is necessary. Carla?
Alors, hier, on a annoncé qu'il y a à peu près
Yesterday,
1 million de jobs qui ont été perdus dans le mois de mars et c'est très significatif. Comme M. Duclos a dit, on a la capacité fiscale, on est chanceux qu'on a cette capacité. Alors, nous comprenons que nos mesures sont pour les 16 semaines et le Premier ministre et nous comme cabinet sont dévoués à décider si ça doit aller plus loin.
And Cabinet has started looking at whether this needs to be extended further. All options are on the table. We continue to assess the situation, and if we do need to go further, we do have the ability to do so, but we are quite conscious of the amount of money this is taking. So this is a very serious decision that the Cabinet must take.
OK, mais est-ce que c'est vraiment sur la table de
But is it really on the table to continue with those support measures at the same scale? Ms. Qualtrough, you said yourself that you're aware of how much this is costing. I mean, among those options that are all on the table, is it possible to maintain this support at the same level?
Absolutely, c'est sur la table. On n'a pas pris de décision, on n'est pas là encore, on ne sait pas comment ça va évoluer, ça vraiment dépend des actions des Canadiens, combien de temps que ça prend. Alors nous évaluons toujours jour à jour, mais rien n'est pas sur la table.
The situation day to day and everything is on the table.
Merci. Prochaine question, s'il vous plaît.
Thank you. Next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Althea Raj with the Huffington Post. Please go ahead. À vous la parole.
Good morning. I hope you all have a lovely Easter weekend, and thank you for taking my question. My first question, I think, is better placed for Monsieur Duclos. I'm hearing, it's a bit specific, I'm hearing about this, so I assume that there are other cases across the country, but I was contacted last night by a man who was told by his employer that everyone in the office will have to take a 25% pay cut because the federal government is only paying 75% of wages. And for context, nobody at this company has been laid off yet. They're considered an essential service. So I'm wondering what your reaction is to this, and might you have a message for employers who are doing this and employees who are being told this? Thanks.
Well, thank you very much for the question. And we all hear from your question that we all have a responsibility to go through this crisis. The federal government clearly has an important role to play, and it has been demonstrated over the last few weeks to act in an emergency manner in a way which is making the lives of millions of Canadians not sustainable when it comes to meeting ends meet. We also expect, and we have I think, communicated that clearly to all business leaders across Canada. We also expect businesses to do their own work, to meet their own responsibility, and we do this in a variety of ways. And one manner which is certainly very strong and I think much appreciated is through the 75% wage subsidy. Now, that wage subsidy is targeted to those employers who would and who are experiencing an important fall in their revenue, in their income, and precisions have been brought on that particular program by the Minister of Finance just a few days ago. That's 75% paid by the federal government. However, we do hope, and in some cases would expect, that employers would add another 25% so that full wages would be paid. But we are understanding that not all businesses will be able to fill the gap between the 75% and the 100%. Now, for those other businesses that are not currently struggling, that sometimes in some cases are even invited and or even adding to their business activities because of particular circumstances, and we would understand and would certainly expect those businesses to maintain their workers and to pay them at the level which would normally be the right level, because in those cases businesses would be going through circumstances very different from the circumstances of other businesses that are currently being very challenged.
Althea, follow-up?
Thank you. So as a follow-up, and I'm going to ask this to Minister Qualtrough, if you want to weigh in, please go ahead. Because to be fair to this employer, like, I do think their sales have declined, but the idea that, you know, when you're seeing people in your own family get laid off and then you're just told that your salary is going to be cut by a quarter because Ottawa is not paying your full wage, as if, you know, Ottawa was paying your wage last month, I think that can come as quite a shock. But I also want to ask about the CERB. There was a report in the Star yesterday that anyone who applies for CERB is basically being given CERB. So is the message to Canadians who now are you know, have fallen through those cracks that currently exist, self-employed Canadians, those with reduced work hours, basically anyone in need of financial help, is the government basically saying, apply to CERB, use it as an interest-free loan and pay it back next year if you don't specifically qualify for CERB, instead of waiting for the government to come forward with a program that helps these people specifically?
We'll turn to Carla for an answer to that question.
Thank you. I'll answer your second question first, Althea. So the CERB was by design created as a simple, straightforward, automatic process. We built integrity measures in at the beginning, like social insurance number verification, but there's also integrity measures built in at the end and during the process at our back end. So we know, for example, how to verify if someone had income or didn't have income. And I hear you, but we also know how very honest Canadians are. And the trade-off would have been to build these integrity measures, so show me your ROE, prove your income, and it would have taken months to deliver this to that many millions of Canadians. So on the one hand, the integrity measures are straightforward at the beginning, but we will, whether it be in the upcoming weeks or at tax time next year, reconcile accounts and make sure people didn't game the system or fraudulently claim something that wasn't true.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Micheline Laflamme avec Radio-Canada. Please go ahead. À vous la parole.
Micheline Laflamme, you have the floor.
Beaucoup. Oui, bonjour. Alors, je me demandais si vous avez obtenu des garanties de tous les partis d'opposition pour que l'adoption du programme de subvention salariale demain se passe sans un croche, ou si vous risquez d'être encore là pour quelques jours.
Without a hitch tomorrow,
si je peux me permettre de répondre à votre importante question, je pense que tous les partis, qu'ils soient au pouvoir ou dans l'opposition, comprennent l'urgence de la situation.
Or in the opposition understand how urgent the situation is. All parties worked together over the past few days to ensure that this significant program,
the largest
measures in Canada, history can be voted on quickly and voted through quickly by Parliament, by the House of Commons. We understand, and as the leader of the House understands best, there have been all kinds of discussions over the past few days, but the House leader of the Government of Canada and the leaders in the House of the opposition parties are doing everything they can to ensure that this program can be passed as quickly as possible over the next few days by Parliament.
Oui, merci beaucoup. Quand on pense à l'avenir, après cette période de confinement, alors
after this isolation period,
quel serait le niveau acceptable de transmission au sein de la population
level
qui va
of
permettre
community
aux
transmission
autorités de dire maintenant on peut
that would
commencer
allow
à
authorities to
relâcher
say now
certaines
we
mesures
can take
isolement.
our foot
Est-ce que c'est zéro?
off
Est-ce que c'est
the
5?
brakes
Est-ce
a
que c'est
little bit.
25%?
Is it 0%,
Encore, c'est une
5%,
question qui relève
25%
davantage de la santé publique. Je vais
answer. Once again, this is something that is better answered by Dr. Liu.
Comme on a dit hier avec notre présentation sur la modélisation.
Answer. Thank you.
Ça
As we
dépend
said
parce
during
que
our
maintenant,
modeling
tout le monde
briefing,
a
well,
fait
it will really
les
depend.
meilleurs efforts, toute la
Everybody is
population
doing their
canadienne.
best right
Et
now.
c'est quelque
All
chose à suivre
Canadians are
parce
doing their best.
qu'on a toujours comme un
And
objectif
it's something we have to
peut-être
keep
1%
an
de la
eye on.
population peut-être infectée pendant toute
Perhaps
la
1%
pandémie
of the
ici au Canada.
population will
C'est
be
sûr que ça va
infected
durer
during the entire
quelques
pandemic
mois
in
au
Canada.
moins
It will last a few
pour la
months at
première
least
vague et puis
for the
après on ne
first
sait pas
wave,
pour les prochaines
and then
petites
we don't
vagues.
know
Donc
what will happen for the
on
smaller
doit
waves
suivre
later on.
les données
So we
parce
need
qu'on est au
to
début de la
monitoring
courbe
the
épidémique.
data. At the
On ne sait
beginning
pas
of the
quand on va
epidemic
atteindre comme le sommet, le
curve,
pic, parce que
we don't
c'est toujours,
know
comme on dit, en
when the
rétrospectif.
peak will be, because as we
Si on
said,
est
it's
vraiment
only in
sur la
retrospect
pente
that we
descendante,
can really see
on peut savoir,
whether we
on
are
est déjà
on the
passé le
descending
pic.
portion of
Donc,
the wave,
pour
and then we can
l'instant,
see, oh, we're past the peak.
c'est vraiment le
For
message
now,
clé, c'est
that's the
vraiment
key
tout le
message
monde
we want to
ensemble.
send out. Everybody has
Tous
to
les
do their
Canadiens et
part. All
Canadiennes
Canadians
doivent continuer
must
avec
continue
les mesures de santé
with
publique,
their
l'éloignement
public
physique
health
et tout
measures,
ça. Et
that is physical
on
distancing
espère
and so
qu'on
on.
va avoir un bon
We
résultat.
hope that we'll get good results from that.
Thank you, Dr.
Terminé.
We'll now turn to the room, starting with our friend Mike from Global. Oh. You've been so patient, Mike.
Sorry. Okay. Is this on? Okay, cool. What percentage of the positive COVID cases are being contact traced right now? And how important is that tracing to getting these restrictive measures removed or reduced or getting us back to normal?
Dr. Tam?
So I know that within across the Canada, all the provinces and territories are doing contact tracing on the cases. At the same time as we're asking people who have any kind of symptoms to stay at home, and of course observe self-isolation as directed from public health. So that is a very key part of the current response. But we know that this virus is a very difficult virus to ascertain who might be infected or not. So this is why these social distancing measures and staying home is so critically important right now. Moving forwards, though, absolutely, as we get this first wave under control, the absolute key is to having sensitive systems to detect any new cases and then to do rigorous contact tracing around those cases.
Thank you. And this is, I have another question about long-term care facilities. And is the federal government considering any measures or regulations or federal oversight to ensure long-term care facilities are protected from this or any further pandemic?
So, as everybody has seen, some of the key drivers of the outbreaks in Canada are the long-term care facilities. So, together with all chief medical officers, this is probably one of the top areas of collaboration right now. I think you have seen Dr. Henry and others in their jurisdiction enacting some very important policies and measures, not only from the perspective of really key infection control measures, but also measures to reduce the amount of movement of staff between facilities. That's actually very important. And also what kind of support people need to ensure that that happens. So right now at the Special Advisory Committee, our key piece of work is looking at the guidance related to how to do infection prevention and control in this population. Really, really vital. And so I think from the federal side right now, at least from the Public Health Agency side, we're providing the federal guidance on the next set of measures.
Thank you.
Hi, Dr. Tam. My first question is for you. I'd just like to follow up on what you're saying there about this federal guidance for new measures for long-term care home, if I'm following. I know in BC, this type of movement that you're saying, the measures there were to prevent workers from working at one facility and then working at another facility. Are part of these measures going to recommend to Premier Ford and Premier Legault in Quebec as well to follow those same measures that were put in BC?
So this is expert guidance, but also it will essentially be a consensus position from the Special Advisory Committee, and we provide that advice across Canada. So, and just stay tuned because we're actively working on this right now.
And my next question would be for Minister Duclos as well as Dr. Tam. There was a release that came out that the RCMP is now going to start enforcing the Quarantine Act as well, following up on some of the compliance measures that public health is doing now. Some of these measures would also include being able to take people into custody rather than just a court summons. So why is this change in policy necessary to get the RCMP involved? Is it because there were so many people that were already violating the Quarantine Act? Why are we stepping up these measures?
Thank you. I'll start, and then Dr. Tam might want to add. We all know that making sure that this situation is resolved as quickly and as safely as possible requires the cooperation and the work of everyone. And that's why we have made it clear over the last few weeks and days that we expect everyone, and especially every traveler coming from outside of Canada, inside of Canada, to follow the strict self-isolation, not only guidelines, but not only recommendations and guidelines, but these are requirements. People must self-isolate for 14 days. We understand that most and a large majority of Canadian travelers understand and apply those measures. But we also are mindful that there are a few that might require perhaps more serious care in particular, defined in a particular way. And that's why we are working with security agencies and police forces across Canada to make sure that when that is needed, and we understand this is rarely needed, the collaborative engagement of all police forces, including the RCMP, may be required and may be implemented. But Dr. Tam, you might have a public safety perspective on that as well.
Yes, I think it's really to give us the range of tools that might be needed. Of course, we're asking everyone that when you're issued an order from the federal government on the Quarantine Act, we expect that to be followed. We are contacting people, and for the majority of the time, you can find them in their rightful place of self-isolation and quarantine. But this is just the range of measures. Then our peace officers, who are designated under the Quarantine Act, can then take necessary measures. And the Quarantine Act has very powerful penalties. But what you don't want is to just apply the really high end of those measures. You want to sort of make sure, fair warnings given, education is given, and calibrate what you may want to apply to a particular person not following the Quarantine Act in a sort of calibrated way, if you like. So I think it is to look at the range of instruments and how you implement this that the RCMP is currently looking at.
Thank you, Dr. Tam. We'll now turn back to the phone. Operator.
Thank you. Merci. Our next question, notre prochaine question is from Brian Platt with the National Post. Please go ahead. À vous la parole.
Hi, I've got a question for Dr. Tam. I wanted to ask again about contact tracing. We know that it's a very resource-intensive process requiring basically a small army of people to make phone calls and so on. When you talk to your provincial counterparts, what's your sense of how close we are to having the capacity to do this properly? Do we have enough people in place, or are we getting there?
Yes, this is a topic of ongoing situational update, if you like, on an ongoing basis. So what I've been hearing is that people do have the human resource that they need, but we're also there to support if needed in terms of surge. Of course, we've been monitoring and forecasting, say, if there's increase in cases, which then means increase in contacts, we're there to support the surge if needed. So you may have heard that we are looking at rosters of course, students, retired public health or medical workers. Provinces doing that already. So you will see some jurisdictions have already put in that surge, and others, if they should require it and we can help in any way, we have that cadre of surge being pulled together as well.
The other thing people talk about with contact tracing is the possibility of technology, including cell phone location data. What kind of discussions are you having about that right now, including whether it's possible to do this without violating privacy laws?
I think that is an area of great interest to every jurisdiction. There are many, many innovators with lots of different ideas. So we are pulling together a group amongst the provinces and territories to gauge interest, and I do believe there's a significant amount of interest, but there is a lot of innovators, and we need to look at each of those innovations, as you say, in particular, as it pertains to things like privacy. I do think that there's different ranges of applications. Some are, of course, for contact tracing, but others are more to sort of giving people alerts so that they are nudged to do the right thing in terms of social distancing. So there's a range of different innovation, but we are together evaluating some of these.
Thank you, Doctor. Next question, please.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Tooney with CBC News. Please go ahead. À vous la parole.
Hi, thanks for taking our questions on this Good Friday. This is a question for Dr. Tam. Briefing notes from February show that health officials were aware of market pressures for getting PPEs. Just wondering, was the push to get crucial medical supplies on the global market in February adequate, considering officials were still advising the government that the risk of the spread here was low?
So just to situate this, I think from about the day one that we heard about outbreak of an unusual outbreak in Wuhan, we started preparing the health response. So absolutely every aspect of this were looked at, but of course at the beginning there were fewer cases. This is a completely novel virus. We did not know necessarily where it was going, but we were tracking it very closely, and our risk assessments, but also our response evolved, of course, as we learn more about the virus every day, if not every hour. So those underwent evolution as we went along. And I think it is as the world came to respond to this particular situation with some very unprecedented measures, including a lot of the border measures that restricted flights, etc., and the major global demand for these PPEs. Of course, we've been escalating every single aspect of that response as rapidly as possible. So as you've heard, every single option was examined. So I think that, again, I just want to remind people that we haven't been in this for very long, and every government department actually escalated and different levels of government really, really fast. And we're learning, we're humbled by this virus, and we're learning as every single day. But I think PPE was probably one of the top priority issues in our collective response and how we're going to deal with it. So I think absolutely.
I would love to follow up on that, but I do have to ask another question for colleagues who are chasing the low testing rate in Ontario, and they're wondering, what is the national strategy to coordinate testing across the country, or are you going to just leave it to the provinces?
There's a really huge collaborative response from the laboratories, from day one, in getting the initial novel testing actually in place in Canada, and now, of course, improving our range of testing capabilities, not just a single type of test, but more than one. But also, as everybody appreciated, just as there was a global demand for things like personal protective equipment, there was also an equal demand of laboratory reagents, swabs, and everything. So all stops were pulled out for doing that as well. But every laboratory, every public health lab have been engaged, and we're there to support each other. So if there's a need, and there's a need for surge, a need for further support to any jurisdiction, we're all there to help.
Thank you, Doctor. We'll take one question in the room and then one last question on the phone.
Hi, Dr. Tam. I have a question about the testing. You've said a number of times, and the Prime Minister said a number of times, that testing is the #1 way to beat this. Ontario does have a smaller amount of testing that's being done every day. They did change the requirements yesterday, or the criteria, in order to get a test, but it still is applying mostly to healthcare workers and people who are going into those higher risk settings. How long do you think it'll be until we have the capability, the equipment necessary, or just the ability to test every single person who needs one right now?
Well, I think we did achieve consensus at the Special Advisory Committee on the key priority groups that must be tested, because that's the driver of the epidemic. And so I think those priority groups, absolutely, we want to be able to cover all of those really quickly, because whatever we do in those kind of settings will determine the trajectory of this epidemic. So I think, every single day we look at our capacity and how we improve it, including the ability to look at domestic production of testing capability. So all of that are on the go. It is very dynamic every single day. So we look at our supplies and we look at how we support jurisdictions every single day. So, as the number of cases come down, of course, on the other side of the curve, the demand will also be lower. So it's a very dynamic process. So, but all I can say is every jurisdiction is trying really hard to get their testing platforms up and running. Some of them might actually be changing their platforms at the same time. So here's the sort of different dynamics at play. But I do believe that our capacity will just keep increasing.
Thank you, Doctor. One last question on the phone, operator.
Thank you. Merci. Our last question, notre dernière question nous vient de Béatrice Britneff with Global News. Please go ahead. À vous la parole.
Hi, yes, my question is for Minister Qualtrough, again on the CERB application. I want to confirm that the government will be clawing back or recouping money from applicants who do get the funding but aren't eligible, and when that is going to happen.
Well, Well, thank you for the important question. So CRA and Service Canada are going to be following up with people who got 2 payments of $2,000. Now, that's not the people who got more than they thought perhaps they should have. Only people who see a double payment of $2,000 will be contacted. And as I said in my remarks, you don't have to call us, we're going to call you. The idea being that we want to make sure overall people don't get more than $8,000 during the 16 weeks. So it won't necessarily be a clawback situation. It might be you can't apply for more than the $8,000. We're going to work with Canadians. We're working with CRA. We're still getting a handle on how many of these payments, double payments, actually happen, which were completely driven by confusion by applicants of the need to apply once or twice. And we're going to make very sure that it doesn't produce any hardship financial on people. And it's why my message is to make sure you budget, because over the course of 16 weeks, you're only entitled to $8,000 total.
Beatrice, follow up?
Yes, specifically on applicants, though, who don't meet the eligibility criteria but apply anyway and receive funding. When are you going to be verifying or conducting the verification process and trying to get that money back?
I would say that that's a bit of a work in progress, and that's not to waffle, but as the situation evolves, and quite frankly, I think the question presumes a little bit of intent on the part of Canadians that just isn't there. We're asking people to truthfully state if they stopped working because of COVID, and people are more concerned about being overly honest in Canada than, our fraud levels just aren't high, and we know this from other government programs. But absolutely, over the course of whether it's weeks or months to follow, we will definitely verify income, verify eligibility, and it will be offset at least during tax time, if not before.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. That's it for today. Thank you, everyone.